The second design principle is that the instruments are manufactured from NiTi M-wire alloy. From the study from Johnson et al. In 2008, we know that the M-wire alloy improves the resistance to cyclic fatigue by almost 400% when comparing files with similar tip diameter, taper, and cross-section. Clinically, this means that the system demonstrates decreased potential for instrument fracture, and the M-wire alloy also provides you with more flexible instruments that allow you to treat more challenging cases safely in your practice. The third design principle, the offset massive rotation, brings along quite an unique file movement with some distinct clinical benefits. To demonstrate this principle, I'm going to show you a spinning top. This top illustrates the movement of a file rotating around the center of mass of rotation, for example, a ProTaper universal instrument. The spinning top on this slide shows the movement of an instrument manufactured with an offset massive rotation, for example, the ProTaper Next instruments. The offset massive rotation movement creates a swaggering-like appearance when the file is rotated, as you can see on this animation. Also note that the tip of the instrument is not off-center, but centered during rotation to eliminate any transportation during canal preparation. The instrument also presents with a rectangular cross-section, and because of the offset mass of rotation principle, the file will only make contact with the dentine wall at 2 of the 4 contact points, as you can see on this slide. Again, the offset massive rotation principle also brings along clinical advantages. If we compare a ProTaper Next file rotating in a canal compared to a conventional file like ProTaper Universal, also rotating in a canal, you can clearly see that there are decreased amount of contact points of the cutting blades with the canal wall due to the offset massive rotation principle, so there will be decreased engagement with the ProTaper Next file compared to the conventional ProTaper Universal file that will result in increased engagement of the contact points with the canal wall. Clinically, this means firstly, less taper lock. Secondly, there will be less screwing in effect of the file when we prepare the root canal, and there will be a reduced amount of torque buildup on the instrument. In other words, we have a much more user-friendly type of file with a safer type of rotation during canal preparation. A further advantage of the offset massive rotation is that it ensures more cross-sectional space for debris removal during canal preparation. If we look at this animation, we have ProTaper Universal F2 on the left side with a triangular cross-section and a ProTaper Next X2 instrument with its rectangular cross-section on the right-hand side. It is obvious on this animation that as the file penetrates down the simulated canal, that there is a lot more free space around the ProTaper Next instrument, the black space, compared to the ProTaper Universal instrument. This concept is also illustrated on this animation. Clinically, the additional space allows the instrument to maintain a high level of cutting efficiency, as a collection of debris around the flutes generally reduces the cutting efficiency of the instrument. In addition, you can also see that it helps to load and to auger the debris outwards during canal preparation. All these design principles leaves us with a system that provides us clinically with less hand fatigue because the instruments cuts effortlessly and very fast, and at the same time we require less instruments as mentioned in the slides before. It is important to note that if we compare the system to ProTaper Universal, that the ProTaper Next X1 instrument does the shaping work of both the S1 and the S2 ProTaper Universal instruments, and the X2 protaper next does the finishing work of both the protaper universal F1 and F2 at the same time. In general, our preparation time is decreased because of the increased cutting efficiency and because we have to change less time between different instruments to achieve our final canal shape. Just before we discuss the clinical guidelines on how to use the instruments, I want to show you a direct comparison with in-house data from Dentsply Mylifer between ProTaper Next and ProTaper Universal to emphasize why most clinicians prefer the ProTaper Next system. Firstly, there is a higher resistance to cyclic fatigue with ProTaper Next of about 60 to 215% compared to ProTaper Universal. There's greater flexibility with the ProTaper Next instruments, 20 to 60%. We see less transportation of about 35 to 65%. There's, as mentioned many times before now, that is a reduced working time because we don't have to change so many instruments and the instruments cuts very fast, about 17 to 30% reduction in preparation time. Because of the fewer instruments, we have improved access, easy to learn the technique, and we can use these instruments in complex cases to achieve great results. Now I want to go through the directions for use of the ProTaper Next instruments, and I'm going to use one of my clinical case reports to illustrate the sequence. Andrew, a 41-year-old male, reported with pain and discomfort on his upper right maxilla. Radiographic and clinical examination revealed non-vital upper first and second maxillary molars. For the demonstration of the DF use of ProTaper Next, I'm going to take you through the clinical steps for treatment only of the upper first maxillary molar. If we look at the CBCT scan of these teeth, we can see on an axial slice that there is a lot of bone destruction between the roots. And on the sagittal and coronal views, we can see large periapical periostitis around the buccal and palatal roots. Also note the involvement of the sinus and the thickening of the Schneiderian membrane on these slices. Before we proceed with this case, let's first talk a bit about canal negotiation. This is a key concept when we do a root canal treatment, to incorporate a cycle of negotiation, to always assure that a canal or part of the canal that you want to prepare is negotiable. Before this can be done, it is important to ensure patency of the canal. If a canal is not patent, then we should not take rotary preparation files into the apical third of the root canal system. After patency, we will create a glide path with hand or rotary instruments, and the last step will be irrigation and recapitulation that will be incorporated after each rotary instrument by taking a patency file to or past working length to ensure that the canal is still negotiable.